everyone. I am Dr. Jessica, and we are so glad you could join us. Today we are going to discuss the topic of regenerative medicine. This includes PRP, which is platelet-rich plasma therapy, and stem cell therapy. And with us today we have a very special guest, Dr. Darla Logan, a practitioner and author of the international bestseller, Regenerative Medicine, Proven Ways to Eliminate Pain, Restore Mobility, and Repair Athletic Injuries, which touches on both of these therapies. So thank you, Dr. Logan, for being with us today. We're so excited to have you here.
Thank you for having me.
Yes. So I understand correctly, you utilize both these modalities in your office?
I do. I have actually been practicing regenerative injection techniques, which include PRP and stem cells, for it's been about 5.5 years now since I started working with these therapies.
Wonderful. So how about we get started right away then? Tell us a little bit about the PRP, the platelet-rich plasma treatments.
Okay. Platelet-rich plasma is one of the very versatile types of injection therapies that we can do, and the reason it's so versatile is because it uses your own body's innate healing mechanism, and we tap into that. So basically what we do is we take your blood out, spin it down a few times in some special centrifuges, and get a really nice concentration of higher platelets suspended in a little bit of plasma. So it's all of your stuff coming out of your body, being processed very minimally, and then injected right back into your body. The benefit of that is that we get to utilize your body's own innate healing capacity, your immune system, to heal the injuries that you've got. And then also we don't have any kind of risk of a medication reaction. We're not using something from somebody else, so we also don't have a rejection problem. And we have the versatility because the body is the body, and the body is very much more intelligent than we are at being able to heal. So we give it the signal and the stimulation, and then we get out of the way and let the body do its work.
So amazing. So we talk about PRP treatment. How is that different from like stem cell therapies that are offered then?
So PRP is going to be your blood coming out and going back in. When it goes back in, there's a little bit of stem cell activity that happens with that therapy. It's predominantly growth factors, and it signals the inflammation pathway to launch, if you will. So there's 3 kind of phases of the inflammatory pathway that we are relying on for both stem cells and for PRP. And when we first do the injection, we hit the very first portion, which is the inflammation pathway. The next pathway that we hit is going to be proliferation. And the third phase of the inflammation pathway is remodeling. The 2 most important phases of that are going to be inflammation, which happens for about the first 48 to 72 hours, and then proliferation, which lasts for about 21 to 28 days in the cases of PRP. So we have some stem cell activity that happens in this area. We have a lot of growth factor activity that happens in this inflammation pathway. Mm-hmm. When we look at stem cells, instead of injecting platelets, which are the first responders of the immune system, we're actually injecting activated stem cells. So you can harvest stem cells out of various areas in the body. The most commonly known are going to be bone marrow or adipose, which is fat. Mm-hmm. In our office, we don't do bone marrow, mostly because it's a very invasive and highly painful type of procedure, and we use adipose-derived stem cells instead, which means we go in with a liposuction. Nobody's complaining about losing a little bit of fat.
It's always a good thing.
And we then break the stem cells out of that fat through a minimally processed procedure, and then inject those activated stem cells right back in. So we have a very powerful procedure with PRP. We take that and magnify it by about 100 times with stem cells to get repair of injuries that are way more severe than what PRP might be appropriate for, or have been longer lasting. Say you were in a motor vehicle accident 20 years ago and you're still having neck pain from the whiplash that the doctors told you nothing was wrong with you, but you're still having headaches from that. Long-standing injuries, very severe injuries. In some cases, I've even been able to work with athletes that have had non-surgical injuries that were career-ending to be able to regenerate enough tissue that then the orthopedic surgeon could go back in and do a surgical repair to save the person's career. So we have a lot of very powerful reach with stem cells. We do with PRP also, but PRP is, like I said, it's definitely on a lower magnitude, so we have a greater efficiency and effectiveness when we use our stem cells.
Wow, so in that, who would be a good candidate for each, the PRP and the stem cell? When someone comes into the office, how would you determine which therapy would be potentially better for one or the other?
The patient's history is very important in everything that we do. Understanding what happened with the injury, how it was incurred, what's the person's lifestyle, what's their overall health. There are some conditions that can make this a little less efficient and effective, such as conditions like diabetes, where there's already an impaired healing process. So I have actually used this with diabetic patients and gotten great results, but we just have to take that into consideration, as well as being able to manage their insulin and their overall health during the procedure. So it's definitely something to pay attention to, but certainly not a contraindication. So one of the other things that is very important to understand is if there's any overall health inflammation type of conditions, largely coming from the gut. If we've got any type of unresolved irritable bowel syndrome, irritable bowel disease, any kind of inflammatory stuff going on in the gut, that can actually take the healing process can take longer, and we don't necessarily get what we're expecting. So those are the things that I definitely want to flesh out in the intake. I also want to know about the history of the injury. When did it happen? What happened? How is it affecting your life? Because you can come to me with a stub toe, and frankly, that might not be that big of a deal. But if you come to me that you're having migraines every day of your life, 3-4 times a week even, 2 times a month even, I'm gonna say 2 times a year, that's gonna impact your life. So I really wanna understand how this injury is affecting you. What's it keeping you from doing? Is it keeping you from playing the sport that you make money and support your family with, which some of my patients are professional athletes? Or is it keeping you from being able to lift your grandkids up and play with them, or get on the floor with your kids? I've had moms come to me that haven't been able to bend over and lift their baby, and that's heartbreaking for them. So for some people, it's about their career and keeping the money coming in so that they can provide for themselves and their family. And for other people, it's about having a quality of life. It's about being able to go horseback riding in Morocco, or backpacking around Mongolia, or taking a month-long hike for a sheep hunt that you've been waiting for your entire life. It's about what is important to that person, and really figuring out how can I best treat this thing that is keeping them from living the quality of life that they want to live.
Absolutely, and that makes so much sense in our medicine, and just really advocating for the patient. So with that being said, is there, and you alluded to this a little bit earlier, are there any contraindications typically in looking at PRP treatments or stem cell treatments?
As far as hard and fast contraindications, there are very few. Things that I do look for are collagen deposition type of concerns, keloiding, hypertrophic scars. We want to pay attention to those for sure, because we are building collagen, so we want to make sure that it builds properly. Another thing that is not very prevalent but becoming more and more well known is EDS, Ehlers-Danlos syndrome.
Yes.
And that is a difficulty in creating collagen. And so we have found some limited results with patients who have undergone PRP or stem cells that have that condition underlying that's undiagnosed. So there's definitely a couple of things that we need to pay attention to. We always want to know, especially with stem cells, because it is more invasive than PRP, we want to know the patient's history. We want to know, is there high blood pressure? Is there cardiovascular disease? Are they a smoker? What are the overall overarching health issues that might need to be modulated as we're going through the healing process, and what might make things slow down a little bit? because one of the great things about it is that each person is an individual. One of the difficulties about it is that each person is an individual. And so what works well on one person may not work exactly the same on the next person. So knowing those individual differences helps me to tailor the procedure and really guide them about what would be expected results.
I love it. It's looking at the total person and individualizing that medicine for them.
Absolutely.
Awesome. Thank you. And do you have any special patient stories you might want to share with our audience that they could maybe relate to?
Oh my goodness. I have a ton of special patients. All of them, I will tell you, I have a good connection with all of my patients. Some of the most fun, I think, was I think she was 65 or 66 years old when she came to me, and she was really struggling with a lot of pain. When she came, she wasn't able to even turn her neck to a full range of motion. She could only turn it to about maybe 10 to 15 degrees from center. And she was having trouble with her knees, she was having trouble with her hands. And so I knew there was kind of some stuff going on without in the full system and not just necessarily in the injured areas. And after we were able to get that all resolved, with the first treatment actually on her neck, she came off the table and she had only been able to move about, like I said, 10 to 15 degrees. And she was able to move completely, full range of motion in rotation. And also that night was the first night she had been able to sleep without pain in her shoulder. So we really took her from something that was impacting her life, not just the pain, but now she's not able to sleep. Plus, she wanted to go horseback riding, and her big goal was to go horseback riding in Morocco, and she wanted to backpack around the world. And so,
and how old was she?
She was 65 or 66 at the time.
Wow.
And so we got her to the point. We did a few PRP treatments on her, and then subsequently we did stem cell therapy, which is great because the two treatments can be used back and forth. If you use one, it doesn't preclude you from using the other by any means at all. So she was able to start horseback riding again, which was a huge thing for her. And then just recently, I've gotten pictures probably over the last 6 months of different areas that she's been, as she has gone on a solo hike trip around Mongolia. There's pictures of her drinking vodka with Russians. There's pictures of her in villages and interacting with the local people. And she has literally had the time of her life. She would not have been able to do this had it not been for those procedures.
Wow, that gives me the goosebumps. That just goes to show age and thinking that we have to live in pain is just kind of a misnomer for sure.
Definitely. And I hear that so much, Dr. Kooima, about, I'm just getting older. My knees hurt in the morning, I'm just getting older. No. That's not how it has to be.
Absolutely. And now you're seeing that firsthand, everyone. And it's so true. And it just amazes me at the beauty of the body's innate ability to try and heal itself. And then just using things from our own body to promote that healing is beautiful and miraculous. Well, thank you so much, Dr. Logan, for being with us today. We really appreciate you sharing your expertise with us. And we hope this offers you an opportunity to learn more about regenerative medicine. This is Dr. Jessica thanking you for being with us. And remember, your life, your health, it matters because you matter.